Residents in West Springfield, like many other communities, have been working together to combat the opioid crisis. The West Springfield CARE Coalition works to educate residents about the epidemic and offer resources for those left devastated by it. Carolee McGrath sat down with West Springfield School Superintendent Michael Rashad, Christine Beaumont, CARE Director of Programming, and Board Member John Weiss about a new grant that will help them continue their efforts.
CARE Coalition started officially in the spring of 2014, but prior to that, there had been a lot of legwork done in West Springfield to get the ball rolling so that we could put this coalition together. It started when a community member approached me in my capacity as high school principal, as well as the superintendent at the time, Russell Johnston, and expressed concerns over the opioid epidemic and what we as educators were doing to address that concern. It hit close to home for us, and we knew that as educators, as professionals, as fathers, we had a responsibility to do something. So we began the conversation of pulling stakeholders from across West Springfield and the region together to talk about what courses of action we could take to address not just opioids, but drugs, drug use in general, and focus on preventative factors and try to eliminate some risk factors that students were doing. So we started a research-based prevention model, and that's really where CARE Coalition launched. And so for the last 4 years, we have been aggressively working to address the opioid epidemic, as well as collect data that is relevant to West Springfield, sharing out that information with families, making them aware of the concerns, and trying to bring light to what is going on in students' bedrooms, in our parks in our community, and in our neighborhoods, because it's a serious issue and it's a deadly one. And we have a responsibility to take steps to prevent it.
So obviously your work has been noticed. You received a $125,000 federal grant. Christine, tell us a little bit about what that will be used for.
Sure. The grant is $125,000 a year for 5 years with the ability to renew again for another 5 years. And the very first thing we'll do is have a full-time staff member, a coalition coordinator for the coalition. So there will be a full-time person working on the efforts of the CARE Coalition, which to date has been 100% volunteer-based. And the next thing we'll do is have the coordinator, along with myself and the steering committee, participate in training to fully implement the drug-free communities model, which is the strategic prevention framework, science and evidence-based work on youth substance abuse prevention.
So explain a little bit about, like, what does that look like? You know, if I'm a mom in your community, what do you mean by that?
So we want to not only educate and inform the community, but we want to work to create community level change. So that starts probably with the youth and getting a good youth group going, active who can help educate their peers and work in the community, educate the community. That means partnering with local businesses that are retailers to make sure that they're not selling to underage folks, and then doing probably some strategic messaging and marketing to parents and empower them, and we'll grow from there. We'll implement further higher level parts of this model, which will be really 100% geared at improving the protective factors in town and reducing the risk for our youth.
So John, you're a business owner, and
Correct.
you're also on the steering committee.
Yes.
Why did you become involved in this?
It's important, as my peers have said here, that it's a community involvement that's going to make this work. People tend to stick their head in the sands, unfortunately. It affects everyone in our community and every community in the Commonwealth. I have people within my family that struggle with addiction at times. It's difficult. It's a disease. It shouldn't be hidden. It should be brought out. People need to be educated about it. And this coalition is going to educate people. We're going to make it a community involvement plan to let people know what we can do, what we should do, how we can improve, where we might be falling short, and the steps we need to take to improve upon that. Okay. One thing we did a couple of years ago at the Holyoke Mall, we did a mock bedroom, and we called it In Plain Sight. And it demonstrated to parents your child's bedroom. There's things you could see here that's going to tip you off there could be an issue. and you should take that tip and follow up on it. Don't be afraid. Too many parents and too many family members say, oh, not my son or daughter. That would never happen to my son or daughter. But we've all known people who've lost son or daughters to overdose, and they're the most surprised when they find out, and it was in plain sight. They just didn't realize it.
And I remember that display in particular, and you've had some other very powerful programs, including bringing in Chris Herron, who has such an amazing, strong, powerful story, of course, played in the NBA. Are those the types of things, because when I watched him talk to the high school, wow, did he have a captive audience?
Absolutely. You know, Chris is just one example of what we hope to do in West Springfield around messaging. And, you know, Chris is a big name with a big message. And we also have local individuals who may not have a big name but have a very powerful message as well. And so our interest is to find who can make a difference, and everyone has an opportunity to do that. When Christine talked about next steps for the coalition, one of the nice things is that we're surrounded by some other communities who have been able to take advantage of this grant in previous years that we can lean on and rely on for guidance and for support to make sure that we're taking the appropriate steps for what is right in West Springfield while tailoring our programming for West Springfield. So Chris Herron, powerful message. He's just one step among millions that we're going to take over the next 10 years.
And talk a little bit about your experience as a now superintendent, but then principal, the things that you would see that, you know, parents would not see on a typical day.
Yeah, it can be devastating. There's a huge emotional toll that I think educators take when they're invested in children, and watching them make some poor decisions and struggle with rebounding and recovering from those. So we've lost students, we've lost some alum over the last number of years, and every time you hear a name or read an obituary, it really hurts. And sometimes we reflect back and say, did we miss something? Whether we did or we didn't, we have opportunities to stop someone else from making that same decision, which is what brings this care work to light.
You know, so some people might be like, do we really need to get the whole community involved? This doesn't affect my family. This doesn't affect, you know, people that I know. Why is it so important to make this a community-wide effort?
It really truly needs to be 100% representative of the community that we're working in. We need to reach every sector of our community because, as John said, there really is no one that hasn't been touched in some way. And we need to find a way to connect with every group possible and get this message across in whatever way is necessary.